Hello, everyone. Welcome to the BAPS podcast. I'm Leandro Menezes, a plastic surgeon specializing in facial rejuvenation. And together with my friend, Dr. Daniel and Júia, we will be talking with Dr. Alessandro Gualdi, a plastic surgeon from Milan, Italy. Well, Dr. Alessandro Gualdi is a plastic surgeon from Milan, Italy, and he performs all kinds of surgery, especially focus in facial rejuvenation, such as a deep line facelift. Let's start. Dr. Daniel, thank you to be with us this morning. Dr. Júia, welcome.
Thank you so much for your invitation.
It's a pleasure to be here.
Well, Ale, welcome.
Yeah, it's my big pleasure to be here with you.
On behalf of BAPS, I'd like to thank you for stay here with us in Brazil, special in our Congress, and sharing your experience with us. Thank you so much.
Yeah, really, thank you. Thank you for inviting me. It was an outstanding meeting. Yeah, it was great to meet all these colleagues and to share with them our experience. Thank you. Thank you for inviting me. Yeah.
Oh, it's our pleasure. Well, just to start, I'd like to talk with you about plastic surgery, and I'd like to understand your work and what kind of surgeries you have been doing in Italy.
Yeah. I'm a plastic surgeon.
Yeah.
I have a master of science in facial plastic surgery.
Mhm.
It's happened during the life. Okay, you start with just. I started with studying medicine. Then I started to do a plastic surgeon. It was my dream. During my journey, I discovered that I started also with hand surgery because I love the anatomy. I love the details, and of course, every part of plastic surgery, the aesthetic surgery especially, is details. Okay, but facial plastic surgery is really dedicated to details because the breast, you can have a smaller symmetry, but you have t-shirts on. Maybe no one's matter. Also, the patient is not so focusing about the symmetry. But now, with the social media, with the iPhone, they have all the three-dimensional aspect of them face. So it's just quite a challenge. For this reason, I just decided to dedicate the big part of my work on the facial plastic surgery. And I love the detail. I love an anatomy.
Oh, nice. In here, Brazil, it's very common. Everyone, especially women, would like to undergo a surgery, a plastic surgery. It's a kind of dream. But I think in Italy, in Europe in general, it's a
the
little
mindset is different.
Yeah. Try to explain for us this difference.
I just thought many time about this. I think I don't know why. Maybe South America is kind of different. It's a dream for every one of you. Maybe till they are hating, they want just a new breast. Maybe in Italy, it's quite different. I think it's a kind of culture origin of that. Maybe religion also. We are Catholic. Maybe many of you too.
Yeah.
But I think about the American. Okay, American love. We discuss about the surgical aspect in many results. Why? Because they want to show that they did the surgery. They pay a lot for that. Because they are Protestant. Okay. And we are Catholics. But I mind it. Just follow my idea. In Catholic, we are the guilty religion. Okay, so you don't have to show to other ones, but you are successful, but you're beauty, but you have something that you want just to show to other one. And for this reason, also in Italy, we have just in Italy too much. Okay, but we have to cover our success. Yes, we do that, but great, you have an Rolex. Oh, that's not true, don't worry, okay? That is our way, the understatement, okay? In US, maybe, the American, just if you are lucky, because God loves you, and you have to show to other one that you are beautiful, handsome, and young, because this is just, they wanted us to show them a surgical result. I think you are here in the same continent, okay? But you are Christian, maybe more Christian than but in the same continent. So I think that you want to show them, but in a natural result. So it's three different aspects. Surgical aspect, they would just have it in the US. So the eyebrow in the middle of on the forehead, maybe in the start. Now that also they come just to another change. In Italy, you have to do that, but you have to don't say it, to show it. And maybe in your country, you want to do that, but you can also speak about that. It's not a problem. But you want a natural result, like what we want in Europe. That is the idea. I think it's a cultural origin of that idea. I don't know if you catch it. If I was able to explain my idea, yeah.
It's almost like if vanity is a sin, so you can't show that you want to look better or that you want to undergo surgery.
Yeah, but I think that is vanity, of course. That is everyone is just undergoing a surgery have some vanity behind.
Mm-hmm.
But I think just the cultural idea about show or don't show, how good is not good, how is it shine or not shine, shame it just to do surgery or aesthetic surgery. Okay, in Italy is already something that you have to cover for this reason. Also the scar, also that is where there's the different moods. Yeah.
In your opinion, in Italy, this desire for plastic surgery, it's the same for the facial rejuvenation, the body, or the facial something different?
Now the world is changing.
Uh-huh.
But also in I think it's in every culture. Thanks to Andrew, thanks to the social media. I saw many results with you.
It depends on the region.
Depends on the region, of course. But I saw that also you here, maybe because what Júlia said, also young people go asking for facial rejuvenation. Maybe it's not rejuvenation, it's beautification, but they are just minded about it. In Italy, I found some ladies which come to my office. They travel maybe from Naples to Milano, just 5 hours train. Just when I arrive to my office, say, "But doctor, I'm 70, but you think it's too early for that?" Yeah, I said, "Madam, it's not early or late time. But it depends on what you want to do. If you need it, if you don't need it, if you want it, if you don't want it." I have to read the indication. Of course, we don't have just to lose this aspect of our work. We have to read the indication. We don't have to sell nothing. Okay, we have to read the indication. When we have the indication, we have an happy patients. If we have the right procedure to sell to them, that is the idea. What do you think, Danny?
Okay, let's talk about surgical approach. Here in Brazil, of course, we have great, brilliant surgeons.
So many, all of you.
Yeah, but when we're talking about facial rejuvenation, probably the approach most common is plication, is mass plication, and we starting to build a new culture, a new strategies. Today, it's a few numbers of surgeons who is starting to develop a deep plane approach. And when you learn and when you start to develop your techniques in deep plane approach, in my opinion, our result start to be great, much improvement.
Yes, because you believe in what you're doing, of course. Otherwise, you do application. Yeah.
But it's very new for plastic surgeons
in Brazil.
Tell a little bit about this approach. In your opinion, if deep plane is a solution, it's better.
We discuss also our session. Now, I think we don't have to close ourselves in two walls, in a religion. Surgery is not religion, okay? It's indication, technique. You have to be able to perform some technique. If you are not able, do something easy. Maybe you can achieve a good result. Maybe we can discuss about long lasting. We can discuss about the degree of the corner of the cervical mental angle. But okay, that is sophism that we do between us. I born in that space, in the deep space, because I was trained by Giovanni Botti, so I just started to do that. I tried also when the max lift and other technique and Andrea, Alessandro just take out. I tried to do that. They are a very good friend of mine, but in my hands, it was poor result, and it doesn't work. I have some distortion, okay, with the post-string after. So I said, why? Because in my idea, imbrication, not plication, is the easy things that you can do there. Of course, you have to manage that space. That is the third space, just because it's full of important structures like the nerve and other things. But when you know how to manage, of course, the result in my idea, in my hands, are better than others. But I saw some brilliant colleagues like Oz and Soldier. He just go on and come back. Now he's just doing something. It's not deep playing in this area.
Mario Pelli.
He's doing some Mario never did. He said that he did. He's just like a father for me, and I never saw him just doing. He do something very aggressive and deep in the neck, but he decided to do nothing. But okay,
Now he come back to the plication.
He do plication in the face, just only plication, and deep in the neck, very aggressive from a lateral aspect. We discussed during our session. So for this reason, you discover the deep plane. It works in your hands. Works. Maybe you can do better. Maybe we just discuss about small or larger skin delamination. Yeah, we can just. It's a brilliant new idea. Nothing new. We did it. We dismiss it in the future. We will see. Every one of us have just to catch many things and just to use the better things just to give the best results. The important is the result and the happiness of the patients at the end. So again, it's not a religion. For me, I was born there, in that space, so it's easier to do the imbrication. I can't do plication. It doesn't work. Having a bad result, bad healing, also when I try to do, I want to just enlarge my skin dissection, just blue face for three weeks. I don't know what's happened. Maybe because something in myself said, don't do that. And when I do, I'm unhappy for that. But I think everything works. I saw yesterday a colleagues who just propose again the big coronal forehead lift. Okay. Yeah. No. But why not? They did it for 20 years, maybe more. And it works. In my head, in my mind, it should be crazy. I could be. Yeah. I can't propose this technique in Italy because if I have some small problem and my patients go to another colleague, he destroy me.
Yeah, but it's hard stuff here in Brazil nowadays because in my opinion, it's a little bit artificial and
that plane or the bicoronal idea.
Yeah,
but I think there's something good inside too. Okay, we have to remain always open-minded. This is what I suggest. For this reason, I try to cut the muscle. I try to do something. I try to change the vector. I try to, all of you try to do something. Okay, it's difficult in 15 minutes during the presentation just to share with what you're doing, which is the process. What I feel that every one of us have some feeling about some idea who is changing or will try how to try to improve this, to improve the so we have to remain open.
Alessandro,
yes.
In the past, when you begin your facelift, the first time, it was a application or
no? It was imbrication. I did it. Yeah, I tell you.
In Brazil, normally,
but
you begin with application.
I was lucky because I find my master was Giovanni Botti, who was quite illuminated man. Okay, so maybe in that time it was 20 years ago, around 20. I was one of the men who did more facelift in Italy and Europe, maybe because I just do 3 with him, and then I back to Genoa. I just spent 3 days with him in Salò, and 2 days in Genoa is my city. Okay, when I go back to Genoa, I have an old friend who has the patient who say, hey, Alessandro, try to do that. So I did 3 days with him from this side, and other 2 days, and I do 5 facelifts a week. At that time, just 2 by myself, I was 28. Okay, so my curve was very fast for this reason, and my first was in that way. But also then I was young, And you are just come crazy. Nowadays, I'm very scared about what I did. Okay, but it works. It sometimes was bad, sometimes was better. And if I think there's no idea about the ligaments, so we do a very good dissection, but sometimes the results were poor. Okay, I think the dissection and the ligament had a new idea and it works. But maybe someone's go around and say it's not important to do that.
Yeah.
And they believe it, and they show a case that it works what I do.
And then, for example, in my opinion, things start to be changed because, for example, I have a baby surgeon with me, and he have been working with me all the time, and his first case is the plane facelift because I do this every day.
For easy, it's easier.
Yeah,
it's more in that space,
Yeah.
like me. Yeah.
if I try to teach him his multiplication, for example, probably I can't because I can't do this anymore. And probably, in my opinion, this generation will start to
Plane.
start with deep plane approach, in my opinion.
Also the glands, but just three
Yeah.
years ago was in a kind of growl. Maybe 4 or 5 years ago, the glands was a growl. Okay,
Yeah.
it was something which just very expert can do that. Now
Yeah.
everyone try to do that. I hope
Yeah.
with very
Yes.
carefully way because it's very dangerous place.
Yeah.
But for this reason, actually, again, I want to say it's not a religion. If you have the glands, if you are
Yeah.
able to remove it. If you are not able to don't, because we have to speak to all our colleagues, the young people, don't force yourself.
Yeah.
Because maybe to your patient, that nothing changes. If
Doesn't
you
matter.
remove, if it doesn't remove, of course. If you want to come to this and they want to show you to very great
Yeah, it depends
worker,
on the
great
patient,
colleagues,
huh?
yeah, I want to show my mandible line. I have to remove the gland and say I'm great because I remove it. But at the patient, maybe the patient doesn't care.
But I think it's very important, many techniques.
You have to know
because-
all the techniques. You have to manage all of them. Now, of course, the young colleagues start
Yeah.
and they
Yes.
want to learn. I start with learning the deep plane, how to make the dissection of that. Now they want to that is just already done. They want to do how to dissect the glands, how to remove it in a safe way. For
Yeah.
this ligature, of course, is the first way
I-
just to save your eyes.
I have been talking for the young surgeons. Man, this thing, this strategy, this approach, I invest 8 years for
it took time.
understand, for try, and you in your first year, you start to do it because when you are a pioneer, you try, you develop, but for the next generation, you don't walk for the same road because you start.
Just one step forward.
Yeah. In my opinion, it's like maybe gift for us because the plastic surgeon developed because we had all surgeons in the past, and that surgeon developed something, and now we are develop another thing, but the next generation will start much with more develop, and this thing moves forward the knowledge, the techniques, and of course the
Now we are just
results.
dedicated to details of that. Yes, of course.
We have a problem in Brazil because the old school,
Yes.
when you want to do a deep plane, they said stop. You can.
But I know, I knew maybe Andre is a very good
Andre,
friend of mine.
as well,
Also
yeah.
yesterday, he just wrote me, come to visit me. It's 3 hours and a half by car. It's not so close, just maybe not. And I come and he invite me in November. Okay, the Brazilian Association. I think we have the same problem in Italy.
Yes.
I'm in the board of the new association, or the aesthetic association, and the old one is just. But also in them, the mind is changing. And I think he is one of the big.
You have this problem.
No, not about the deep lift, because I think we have to be, I don't know, able to remove this kind of fight. Fight doesn't help anyone. But for this reason, he said it's not a religion. Open close rhinoplasty. Now the problem is not open and close, but it's just. I saw many Taliban. Okay, I want to just. It's not nice just to the name, but I just spoke about monument. Okay, in Italy we had someone who just came from Bergamo. No, I don't want to say the name. It's just a great one who take the ribs to anyone. Yes, why not? Okay, why you have to remove the ribs to everyone just to do a nose also? It's not a secondary. You can just manage simple nose. You don't have to open all the nose. Indication, you have to be able to do open, close, preservative, and structural rhinoplasty. You have to able to be open mastopexy, maybe, but also you have to know to be able to do a subskin dissection facelift and couple of stitches. Why not? If you start, also your maybe the guys who is following you, maybe his first start is his first facelift is the neighbors, the uncle, and someone. He starts to say, okay, why not? It's not a shame. Do what you are able to do, what you are in safety to manage. So small skin dissection, couple of plication. If you understand what it works, it doesn't work, or it works for 6 months, it's enough. That's your first, and your second maybe you do something more. You just give behind it, you do something just to do the imbrication, not to do the dissection. It's one step forward. Of course, it's just one more to stay close to you like me. That is my way. But also in this 10 years after when I left Giovanni, I just move on in a different way, okay? Because he was very aggressive in something, less aggressive in other things. I wanted to achieve this result. I said in Milano, okay, it's just, very fast city like São Paulo. It's just like a fashion city, okay? All of them just want to do fresh, but I don't want to say to anyone. So the problem is the healing, but they want a long-lasting result. We don't want to maybe this is the problem. We don't have to speak about which result we are giving, but how long-lasting is the result. But also in my experience, I can remove all the ligament. I can tie it with prolene and also with the screw. It just never is forever. Okay, I saw some results which just after 15 years are perfect. I don't see the scar where are perfect. And some result that I do everything, so I just cut the muscle, I make the implication, I do the platysma raffia and remove the glands, and they are not so. They are happy. And I look at them. I did a lot of procedure for a very poor result.
And here in Brazil, it's very common thought. The facial rejuvenation is a kind of surgery for old surgeon. If you're young, if you need to have 1,000 of all kind of surgeons, start to getting older for start to have clients. In my opinion, it's wrong. It's everything is possible, but you need to take a decision and start to build your
practice, your career. Of course, you have to start to make a decision. What about you?
But in Italian, it's the same thing. It's the same kind of.
But I think in Italy, of course, now also, thanks to the social, the world is changing. But you have to have the white hair just to work, especially in the face. I'm agree, but in this way. So the curve is just a little bit more slowly. Just if you want to do the deep face, the deep approach. So for this reason, maybe also the ladies who just come, they are more than 60, so they can speak with some 30 colleagues who is just with the best one. I say, okay, doctor, you don't, but also because you need the the flyer time. It's like when you drive you are good, of course, but experience. Because every one of us, you can catch one of them, show our 3-4 videos, 3 of mine, 3 of you, and after that say, okay, try to replay that. Maybe he can do the best one, but after 100, he had a problem. And the good one is not who just have 100 of good result, is the one who just managed the problem.
Yeah.
For this reason, you need experience.
We talked about this the other day. I believe that facial surgery here in Brazil especially is a surgery for older surgeons because the patients will age with the surgeon. So
Yeah.
you
But
do a
they-
breast implant, and then you do an abdominoplasty after they get pregnant, and you start getting older with your patients.
But
and
you think because I'm older?
well, you did say that you need to have gray hair. So
Because I just painted.
oh, so that you need to look a little older.
And white hair.
Well, but anyways, so
I'm
with
just
that,
joking.
I wanted to ask you, what are the other surgeries that you do today
Yes.
apart from the face?
Yeah, no, I'm just do breast. But
Mhm.
actually, we have to be clear and honest. It's not easier. Just do breast surgery. It's not easier than the face.
Mhm.
Also, to do liposuction, if you do stupid movement, it's simple. Every part of our work
Mhm.
or our discipline is a point of art. If you go dedicated in HID liposuction, of course, it's so difficult, and you have many tips that you want to follow. Also in the nose, I think it's just for this reason we decide
Mhm.
we are going to the hyper specialist.
Mhm.
Okay, in the face, you decide to, maybe you too, and I do that. Okay, well, it's different. I have an old patients, as you say, because I
Mhm.
did the breast. They come to me for do the abdominoplasty.
Mhm.
I do that, of course, but I'm not happy to do that. And maybe because I do it from her, because it was my patient, she
Mhm.
wanted that I do that. She just thought that I'm good in that. I'm good in that, but I'm not in the best, because I'm sure that maybe in 3 buildings close to me, there's another guy who do that every day. Like
Mhm.
me, I do facelift every day. Of course, it's best.
Yeah.
It's faster. He's come to this meeting. I just followed just the first day because I'm involved. I was interested in the face, and I'm interested to see your result. I didn't go around to show the breast presentation.
Mhm.
You need
Why?
to dedicate.
Yeah, I'm not dedicated anymore. Now I'm 50. I decide what I want to do. I want to do what I want to do when I'm old.
But in other hand, this thing start to happen with me. Some clients start to choose me because I'm young. Oh, I'm here because you younger and you have a different way to think, a different
also good.
strategies. And in my point of view, maybe start young, maybe could be taking
Plus.
take
plus,
an
yeah.
advantage.
Yeah, it could be just
For example-
new techniques, okay, new view, and young colleagues. But I think it's just
And
it's all like in a kind of fighting between us.
And for
You have to
example,
relax about this.
I love Bentali. I love Bentali approach, and that guy start to be famous with 42 years old,
Mm.
and maybe it's the big five in the world, and
Yeah.
very young. Of course, he's a
Yeah.
genius.
No, he's a genius. He's a smart guy. But also this is important. Just to say to the young colleagues, but it's two different things that you have to do. Once is just to do your work, and you can do the best in your work, and no one of us we can know him. So he stay in his office doing surgery. He didn't want to go to share everything. It's not interesting to go on the desk, on the stage. Sorry, and maybe like a rock star. But this doesn't mean nothing. Okay, you say he's a genius. Yes, Ben is a genius. He's a good friend of mine. He's a great one. But the idea is just now the world is changing. For this reason, I would say you say I'm young. Maybe in the next 10 years you become one of the old one. Okay, so and maybe you will fight the young one. Yes, so you have to be colleagues, everyone, just to share our idea, and to remain open to everything. Also to subcutaneous dissection and some small plication. Because I never did it. I did maybe a couple, and it was a loser for me. But I believe that there's some indication also for that. Okay. And also, of course, maybe now because you are crossing your age and you are growing and you want just more patients, and there's some patient you just say you sell your youthness because you say yes, this is a new technique, I'm a new surgeon, I do that but okay, and maybe the whole one said this is just bad for us. It always is some lobby to another lobby. It's not
Yeah.
a good way.
Yeah, but very beautiful thing that's happened here.
Hmm?
Probably because of BAPS too.
Yeah.
We start to create a very close group with facial surgeons,
Yes.
and everyone start to share everything with this group, and everyone start to grow together.
Together.
And it's a very very beautiful thing, very difficult because surgeons in general are difficult,
To share.
are hard people, but I have been loving that thing.
Yeah.
Share with
This is what I
this-
suggest.
this
also
group,
with the whole one. You have
and,
to find
and see everyone grow,
to find a
everyone
bridge
develop.
with them. And it's not easy because I know with old people, but
Yeah.
because it's the idea.
Here we have two associations, and these
Also
associations
in
BAPS
Italy.
are much more open
Open.
for new things, new approach, new surgeons,
New idea.
new ideas. Yes, and maybe this is the first reason why everyone is here now.
Yeah. Also, I know. I remember Giovanni Botti. We were maybe I don't know where, but in somewhere. Is just showing something. It was like a baby. Just no other ones was interesting in that stupid details. I say stupid. It was no, Alan. It should be amazing. Okay, because he's still so curious. The idea that don't stop to learn everything.
Yeah.
Every day something new. Remain open mind. Maybe we will meet you or each other in the next 15 years and we say, "Wait, what are they doing? Something stupid." And maybe that is an amazing idea and we are not ready to catch them. Because that is.
Yeah,
so
it's
the idea.
possible, of course.
Let me ask you, just change the subject a little bit. Tell us a little bit about how your practice works, how's your routine at home.
Yeah, I'm just doing. I have my day surgery.
Mhm.
Okay, is in Milano. Okay, so I have my home OR and other things. We do consultation, many practice, just many other aesthetics like laser and other things, and of course also the.
Have you performed non-surgical procedures?
I prefer that.
What kind of procedures do you do?
Just buttocks and hyaluronic acid. That is. And I think they are so powerful. Also,
Mhm.
okay, in a simple way, it's just an idea that just is in the first step. Okay, entry level to have also to meet the patients. As you say in Italy, maybe. Okay, it's not so easy to go to the surgeon to ask face surgery. So they enter for the back door.
Mhm.
Maybe. But this reason I do that. Because it's the way for them just to start to speak with me.
To get to know you.
Of course, now maybe I'm not famous, but I'm old.
Mm-hmm.
Okay. And they come to me just directly because I want to do that. I
Mhm.
saw many facelift. I do many style videos. So I saw her. I want to do the same because you are. Okay. Now, because I have the flying hours. But I still do that. I love that also because it's very powerful sometimes. Now also I saw in the chat, there's some is growing from the surgeon, some fight to the filler, to the things, because doing the deep plane, I have the same problem about the energy device, but okay, we're just the same way what I describe to my patients. I do black and white before and after, okay, but you have to enter in the tunnel. You have to wait 1 week, 2 weeks, and I saw many results, okay, after 1 week. Okay, we have to show the result after 50 years, after 10 years, after 5 years. Okay, that is the idea. After maybe when I remove the stitch, the scar is invisible. Okay, after 1 month and a half, the scar is red like this and thickened like this. That is the idea. So I just lose myself. Sorry about this film.
I wanted to know how your practice works.
Yeah, my practice.
So
sorry.
do you have surgical
I do
days?
surgical
and-
day. I try to manage. I sell also my OR to other colleagues.
Mhm.
Also just I prefer some excellence and then when I do rhinoplasty.
Alessandro, what do you think about the technology and nanofat?
Yeah, no, that works.
You do.
I do.
Yes.
I do. Also, the technology.
What
this
kind?
is what I said.
What kind of technology?
Also, sorry, I just lose myself about black and white before and after, and not all are ready for going in the tunnel to do the surgery. Okay, maybe for the age, maybe for the mind, maybe for the husband, maybe for the son, maybe for the works. Many problems. They have just to stop to freeze their life for 2 weeks. It's not easy. I can't. You can? No, you can't. Okay. So the idea that I say black and white, but if you do some Botox, some filler, some nanofat, some laser, some more radio frequency or other things, you have gray, more gray, more gray. You have something which look black, more dark gray. So you can make a modulation of that. But this is what I mean.
Yes.
About fat, I use it. Of course, it's so powerful. Okay, but I say what would you describe about the problem of this area? Okay, because we want to put fat, we want to full an area that is never be full. Okay, that's an insertion, muscle insertion. It loses just an inflation about the bone reabsorption. And this is the problem maybe, because we want to put something where there was nothing in all the life. Okay, but of course it's so powerful. In my hands, it's impossible to sell lipofilling. I say sell because when I do a procedure, I ask some money. When I ask some money, I have in my mind also maybe for the law, just to promise some result. Okay, when I use fat, I'm not sure which result I can give them. So I use it. It's like a salt and pepper for the chef. I use it during the surgery. Maybe nanofat for the skin surface. Also this skin surface and also that is so important. We can do the best facelift, but we don't treat the surface of the skin. We could
how do you manage the skin surface? What do you usually
just
do?
Laser. Now I'm looking for to have some laser during the surgery. Okay, I didn't perform before. Okay.
So did you do it after surgery?
Before and after.
Before and after.
After.
Do you do it, or do you have
I have
somebody to do it?
someone to do it. Yes.
And in Italy,
And I teach to the surgeon, to the university. You just spoken about my.
Okay. And about what kind of laser do you use?
I'm actually it's just an fractional laser, not ablative. But I'm looking for CO2 ablative surgery to do laser to do during the surgery. That's it, just okay.
Do you like a Morphos?
Yeah, I have it. I have it. I like it. I saw Alessandro. I have this idea. I never use it together during the surgery. Maybe it should help us just in this area. Just when you open the flap, just using the face tight. Why not? It could be an idea. Let's see.
Alessandro have been using
I saw him.
with
He's so smart.
in all
But okay, of course we are just to grow. I saw also I shared some idea with when you try to achieve the deep neck after face tight and Morpheus was a nightmare, really nightmare. So just ask to the lady before, or if you want to do that to your patient, don't start with that. We spoke about this, a little bit of this, a little bit of this. Is the project maybe in the next 2 years to do deep neck? Don't do that because you become crazy. But of course, maybe we can find a way to share them together, just to do the Morpheus during the surgery. You do that? You have an experience of that? It works? Because you can just bumble up. During the sleep. Or maybe during the face tighten, many things. I think all of this and that technology works, okay? The problem is when we want to just achieve the same result with face tight, maybe it works on the Morpheus. They want to do the facelift with Morpheus. It's impossible. Or maybe we have unhappy patients at the hands. What do you think?
Italy has a very beautiful idea, La Dolce Vita.
Yes.
Trying to enjoy the life and not just work hard every day, every week, every time.
Yeah.
That
is true for the south of Italy.
This idea
work
for surgeons too.
Yeah. No, this is not. This is not true anymore. You know, Italy is a wonderful place to live.
Yeah.
For like Brazil, we have very wonderful landscape. many nice things to eat, good smell. Yes, from Capri to Portofino, I'm from there. Also Milano,
They're a
many
special
things.
country, no?
Yeah, the special country. We invent the luxury, we invent the beauty. We are so small country, but you mind something that you wanna in your life. Ferrari, we invent it. You love the pesto, we invent it.
Yeah.
No, I'm joking.
But
You say Botticelli is one of our guys.
but tell us a little bit about your life.
Yeah. Also,
if you
now,
can manage,
yeah,
or you just have a very busy work life.
Our problem is that, as Alessandro said during our congress,
Yeah.
it's a passion.
Yeah.
I'm here. Now is middle of August. There's a kind of story we say in the middle of August in Italy, you can find also the hospital closed because
Everybody's on vacation.
We are in vacation. Oh, everything is stopping. You go around Milan, it's like Corona. There's no one around. Okay, I'm here with you because I want to just maybe in freezing, not on the seaside because I'm good. I want to say thank you again for inviting me because I love to share. I love to teach. Okay, and that is the idea. And so everyone who's doing, I believe in that, with my same passion, like all of you, like all my colleagues in Italy, is just do two things, maybe three. Okay, one is just minding about my work, about to grow to achieve the best result. The second one is just to do something interesting, just to do maybe family, okay. And the second is just maybe to do something with your wife. But when you are your wife, you're speaking, you're minding about your work. That is my idea. So we are following in that. There's a passion for this reason. Okay, we just believe in Dolce Vita, but we work a lot. Like a surgeon.
We will starting to finish your podcast.
Sorry, I spoke a lot.
No.
No, that was
it's a very-
that was the goal.
It's amazing time. I wish you suggest something for a young surgeon who decided to develop your career, focus in facial rejuvenation. What you talk for this young surgeon?
Yeah, I think that's the first time is just to remain open-minded, okay, and to don't have rush, of course, because they are also young or old. You don't have to be rush when you do surgery. Of course, if you are able, you are fast, but it's not important to be fast. The important is the result. To remain focusing on result and what the patient. Just follow what the patient wants, and anatomy. Anatomy is the base. Without anatomy, well, nothing. So when you know the anatomy, you know what you are doing. Maybe this is just my suggestion. Anatomy, no rush, and as just someone else said, yes, you have to be foolish and to be hungry just to do this work, and to remain that, not that start. And another suggestion, I saw many great colleagues and many also you, okay, maybe just not personalize too much. Maybe I do the same problem, okay, but now I'm relaxing, we are friends and we're discussing. Not personalize everything, okay. I saw also in the media, Gualdi lift. Sounds. I just discussed you about the G point. Okay, it says Gualdi suspension because it's nice. Because it's just not the one discussed before. It's not so important if you use it. Just it's a funny way just to discuss about it. But it's okay. Also, but it could be a problem. Okay, now the world is changing. Maybe you said maybe also during the presentation, I do the same way. I put our pictures. It's not important our face. It's important our result and our idea. We are just to come a little bit. Now the world is changing, and then we have just to manage this changing. Okay. So also me, whatever, and just say this is to me. Just once we have just to put our just a small step behind of our face and give more space to our idea. Just if the idea works, you don't have just to put your face on.
Alessandro.
Mm-hmm.
You believe in that?
Yeah.
Yes. What do you think about BAPS? Your experience?
Oh, my experience was amazing. It was amazing because we grow in Italy. Where every time when they say I'm a plastic surgeon, we know Pitanga. Okay, but it's
Yes.
like Paolo Rossi. You know Paolo Rossi?
Yeah.
He's dead, poor guy, but he was a great soccer player. Okay, it's like you are from Argentina, you know Maradona. Okay, that is you're Maradona. You have a lot of Pelé. Okay, and then there's Pitangui. And when you say I'm plastic surgery in Italy, they say, okay, what about the Brazilians? Say I'm moving to Brazil because they are so nice to invite me. And I find what I expect. So a lot of energy, a lot of good result, an amazing result. And what I feel between you, because maybe you're a new society, new group, is the friendship.
Yes.
That's
Very good.
what we don't have to forget. I want to be, of course, and you were so warm with me.
And we have we have another one friend from Italy.
Yes, thank
Yes.
you, and I'm very happy and glad for that.
And Julia and I have been visiting surgeons from all the globe.
Yeah.
And now we have
a new spot to go, Milano.
we
Yeah.
we have a new destination.
You're welcome.
My next
know.
destination.
Yeah, you're welcome. And we find just a way not to do only surgery, but to enjoy something in life. Remember, if I can, if you want to go to Milano Face Institute, where we have a great meeting in January. We have Ben,
Yeah.
Mike, Dominic Bray, Mario Pelle. I try to share to put them together. Okay,
Yeah.
Giovanni Botti, of course, Carlos Neves, Michele Pascale, is a good friend of mine. All of them
Yeah.
together.
Probably we will go there.
Welcome, of course. We do 3 days with surgery and discuss and of course I asked to Chachi, Kao, and other things. The idea is just to ask them, just to show them result, but to give us the time just for the discussion, to the question. That is the important. But what we are doing today, just to speaking about what you do, how you mind about that. That is the idea.
Okay, thank you so
thank
much.
you again.
Julia,
Thank you.
your finished words.
Well, thank you for joining us. It was great to learn from you and looking forward to visiting you in Milan.
Yeah, you're welcome always.
Daniel, thank you.
Hey, thank you for coming to Brazil. Thank you for coming to Brazil and talk about your experience for us.
Yeah, thank you for inviting me. It was I really appreciate your warm. Thank you.
Ali, thank you so much
Thank you,
to
guys.
your time and for having with us on BAPS.
Next, invite me during the summer.
Yeah,
Okay.
yeah, it's a very, very, very different thing for us too.
You give me hand. It's so cool.
Perhaps the next time in
I'm
Rio.
pretty cool too.
Unreal, amazing.
But you just invited